I'm Kat, an independent midwife from Wales. Welcome to the Mother of All podcasts, where nothing is off the table of discussion. If it leaks, cries, swears, screams, goes up, but doesn't stay up, we're talking about it. It's time to get raw and real. Your no BS guide to pregnancy, preconception, birth, adolescence, wet dreams, wet in the bed, coming home pissed. Who knows? Whatever. We're just going to talk about it. Life in parenting doesn't come with a manual. Well, not a decent one anyway. So let's just create a podcast. Welcome to the Mother of All podcasts. I don't even know where that comes from.
Oh, that's good. That's good.
That's not even in it.
That's good.
Welcome back on
Thank
Mother
you.
of All podcast. Introduce yourself.
I'm Charlotte. I'm the mother of two. And previously, although I'm not a nurse anymore, I used to be a nurse working in contraception and sexual health.
And that's what we're going to talk about today.
Yeah.
Well, typically abortion.
Yes.
There's not enough out there. So we're going to open the conversation, try and be as factual as we can.
Yeah.
I've had experience with it, as I'm sure most people out there have. I'm quite open to talk about it. Most people are not. So, you start.
I think abortion is understandably really controversial.
Mm-hmm.
And mostly it boils down to if you don't agree with abortion, then you shouldn't have one. But like all things in life, it's not black and white. Life is very grey.
Mm-hmm.
And I don't think any little girl thinks one day, I'm going to get pregnant.
And I'm going to have an
and
abortion.
I'm going to have an abortion.
Yeah.
And I think it's an incredibly physically and psychologically difficult thing to do.
Life-changing for some.
Life-changing for some. And I think there is so much shame and stigma about it that it is an unspoken hurt that, a third of all women have? A quarter of all women? And it's...
Oh, and is that true stats? Because not everyone comes forward either.
Well, that's it.
Yeah.
So I think the more it can be spoken about factually, the better.
Yeah.
So people can make an informed choice.
That's all it's about. And
Yeah.
in any other aspect of life, you should have a choice. But when things are left unspoken, you don't feel like you have one.
Yeah.
Does that make sense?
Yeah.
It's quite a lonely topic for some, because there's not many people that you would go and speak to and be like, fuck, I'm pregnant, I'm not really sure I want this kid. So I think the first thing I wanted to speak to you about was, what is the counselling service like? So if a young girl out there, or an older mum,
Yeah.
is out there and finding themselves in that situation, so they contact BPAS or whatever kind of service, go private,
Yeah.
and they're offered they have to have a counselling session to see, is it if they're of sane mind to make that decision?
So they don't have to have a counselling session.
Okay.
But you do have to talk to a nurse or a midwife. It's kind of 50-50. A lot of midwives work in the
Yes.
in the arena. And you have to be completely sure of your decision. And two doctors need to sign off that you can have an abortion for it to be done. And if there's any wavering or uncertainty, the practitioner will say, I really think that you need to go away, speak to somebody. And there is pre-abortion counselling and post-abortion counselling.
Okay.
But none of it is mandatory.
How do they judge whether someone's 100% sure
That
if they want it or
you
not?
can really tell.
Really?
Yeah. I'm going to caveat this for most women.
Okay,
Because we are all
Yeah, well,
individuals.
yeah.
And I think for the majority of women, choosing to have an abortion is a difficult thing.
Mhm.
And I think for a lot of people, it's a heart-head argument.
Yeah.
And I think most people come along. So if you go to an abortion clinic, you can't go in with a partner or a friend. You have to go in by yourself, because one of the biggest worries is people being coerced
Yeah.
into having an abortion. And I think for a lot of women that's really, really difficult, because they go with their boyfriend or their partner or their
Yeah.
mum or their sister or their best friend because they're struggling to do this.
Yeah, and they need that
and
support.
they need that support, and then they have to go into a room with a stranger and hear a list of risks and what's going to happen. I think that's really, really hard. And
Yeah, it's a fine line, isn't it? Because I've had an abortion. I've had 2 actually. I am literally an open book. So I experienced all of that, and you know, my reasons were my reasons, whatever. And it is horrible. And I did have supportive partners. Or did I? Well, I thought I had a supportive partner who I
hindsight.
definitely wanted. Yeah, definitely. Well, there was a reason why I was having an abortion. Who I would have definitely wanted in the room with me.
yeah,
Very young, very naive. And they couldn't. So, and I was 100% sure.
Yeah.
So that's why I asked, like, how do you judge whether someone is 100% sure? I suppose it comes part of the job, part of that
It
learning
does.
experience.
and I think people tend to go into nursing or midwifery because they're really good with people
Yes.
and talking to people and making a rapport with
Gauging,
somebody quite
yeah.
quickly. And most women in that situation will be like, I don't know, or they might say, am I doing the right thing?
Yeah. That's difficult.
Really hard, because what do you say? So a 13-year-old
You
comes in,
you can't say it, but your brain, being a mum as well, is
Yeah.
you're totally doing the right thing.
totally doing the right thing.
Yeah.
Your life would change
Dramatically.
And obviously there's
rules and
There's
legislation.
rules and legislation,
Yeah, of
and-
course.
and a huge part of the job is safeguarding. And you see lots of very vulnerable women,
Yeah.
human trafficked women, prostitutes. You see the people that you imagine
Yeah.
would have an abortion. Your 17, 18-year-olds. Interestingly, 22 is the kind of peak age where most women have an abortion.
Really?
Yeah. And that kind of fits in with university and drinking
Yeah.
and party kind of culture, I guess. Or you could say that they're just at the beginning of their careers and they're making that choice.
Yeah. That's
for
right
a
for
career or
them.
family. Yeah, I mean,
How do you feel like this service can improve?
so I stopped being a nurse in 2019.
Mhm.
So in all fairness, I've been out of the game
Yeah.
for a while. I think when I was doing it, even though abortions were funded by the NHS, the majority of people that were having them were from such financially deprived families
Mhm.
that getting the train to the clinic
Yeah.
would be the choice between them feeding their kids and having an abortion. And that was what really, really struck me. The like, am I doing the right thing voice that we all have when we're doing a controversial
Yeah.
job. It was like, yeah, these are like desperate women.
Yeah.
And the charity I worked for was amazing. And at that time, you'd have to come back the next day to get your tablets.
Yes.
So it wasn't just like they had one trip.
Yeah.
They'd have one trip to take the first set of tablets, and then they'd come back either 6 hours, 24 or 48 hours later for the second tablets, depending on their gestation. And that was really hard for some women. Really
Never
hard.
thought of the financial implications.
Well, or they'd have
'cause-
to have somebody look after their children and pay for that.
Yeah.
They'd have to maybe sneak away from their husband or their partner. They'd have to find a secretive way, and train fares are expensive. This could be 50 or 60 pounds.
Everything's expensive when you don't have the money, isn't
Yeah.
it? Did you feel like you were helping? Did you have like much love for your job?
It was my favourite job in nursing that I'd had.
Oh, I love that.
But I think I was a theatre nurse, so I was with unconscious people all the time.
Yeah.
So apart from a brief stint on labour ward,
Yeah.
helping with C-sections, I didn't speak to my patients. There was a joke, I'd walk into recovery and I'd be like, can someone point out which one was mine?
Yeah.
Because it was a blue sheet with a hole and a cut.
Yes.
That was it. And although we did life-saving and amazing things, it was another person.
Yeah.
And talking to women who were
Distraught.
and desperate, and vulnerable, and it was really. It felt at the time like I was making
A purpose.
a real difference. And then talking about contraception,
Yeah.
because that's the other big part of it.
Well,
Is can they leave the clinic? Yes, having an abortion, but with contraception in place, because the two are necessary.
Well, it goes hand in hand, doesn't it?
Yeah.
Hit me with some stats, some facts, because that's what we want to talk about.
Well, so a bit about the abortion law has changed recently, or is kind of going through a process of being changed. So from June, it's been decriminalised. So prior to June, you could have an abortion up to 24 weeks for a few reasons.
June this year.
Okay. Before June, you could still have an abortion after 24 weeks on very, very rare circumstances.
Yeah, it's normally called MTOP, medical termination of pregnancy.
Yes.
Yeah.
And that was if the mother's life was at risk, or if the child was going to have such severe life-changing
abnormalities. Yeah.
And we're talking like 3,000 abortions out of 215,000 abortions that happen. So it's a really
small margin.
Really small margin. Most women have an abortion under the part of the law that says the continuance of the pregnancy would involve risk. Oh no, that's not the right one. Excuse me. That if the pregnancy has not exceeded its 24th week and the continuance of the pregnancy would involve risk greater than if the pregnancy was terminated, and that is to the physical or mental health of the pregnant woman.
And that's the norm.
That is
the tick box, the normal tick box.
The normal tick box.
So what do you mean by the rules changed in June?
So if a woman was found to have an abortion or suspected of having an abortion outside of the guidelines, they could be criminally prosecuted. Now, up until a few years ago, actually, nobody had been prosecuted.
Yeah.
And then maybe 5 years ago, there suddenly was like an increase in police prosecuting women.
Do you think that's because there was a rise in it?
It could be.
Yeah.
I don't know whether... who knows whether there's a political change or... it did seem to kind of coincide slightly with the American changes in Roe versus Wade, the abortion laws in the States. And the problem is these things couldn't be proved.
Yeah.
So you could essentially be putting a woman who's had a miscarriage and is grieving the loss of a child that she really, really wanted through then a costly and life-changing and very distressing situation. So I think it's brilliant that they've changed the law and that abortions are now decriminalised. There's a caveat to that. They still have to be done within
the right context.
The right context.
Yeah.
And it's still a criminal offence to provide an abortion for somebody if you're not a qualified practitioner working within the right healthcare setting.
Okay. So I have an opinion and thoughts on everything, but this is so controversial, I'm going to hold back for the first time in my fucking life, I think. Only because it's a choice, and I believe, and I've obviously been open and honest and said, it's still such a taboo though? Why? Why do you think? That's not an opinion on abortion, that's me asking you, why do you think it's still such a taboo? And should it? Do you think it should be?
I think when you've had a baby and you've held your baby in your arms and you look down at that baby, the thought that anybody could end that life is awful. It's just the worst thing you can think of. And I really, really understand why people don't agree with abortion.
Yeah.
It's really understandable. I do think that is an opinion that until you are that woman in that position, that you just can't.
No.
You can't understand. And that's why I really think our laws around abortion are really good. I think there should be... That was
my next question.
There should be a cap.
A cut-off.
Yeah, there should be. It shouldn't be used as contraception. It is...
it is used as contraception.
It is by some people. And I think... There was that Lily Allen interview on her podcast a little while ago, and she said she can't remember how many abortions she's had, and was quite kind of nonchalant and flippant about it. And yeah, personally, I don't agree with that. Like, it's huge. It's a big thing. And I think,
going through it myself, it's not something you would just go out, have a shag, and then think 6 weeks later, oh, it's all right, I'll just go to the clinic. It's not for that purpose.
And I think it needs to be treated with gravity and respect and compassion and kindness. But in an ideal world, would we be in a situation where women didn't have to have abortions? 100%.
Of course. Like, talking about contraception, I think you asked me before we come on, how do we, just talk about the rates, how they've risen.
So since 2011, abortion has been going up, but massively. From 2016, it was about 185,000 abortions happened in England and Wales in 2016 to 215,000 in 2021.
I don't know why, so my opinion isn't based on, I think it's because of this reason, but this is going to probably piss more people off than my ideals about abortion. I don't like contraception.
Yeah.
That's not why I had abortions, by the way. I was actually on the pill when I had abortions. They mess up with your system. Female physiology is so specific, so precious. It needs to be looked after. And anything that you're ingesting messes with your cycle, and you don't actually realise until you're older when shit starts to happen.
The contraception.
And you come off it and you realise how great you
feel. Different person.
Yeah. So I think it goes back to girls learning about their menstrual cycles.
But I think it has to be girls and boys.
Oh, of course, yes. No, definitely, I agree. My three daughters, my two daughters and my daughter-in-law, they had a session with a cycling coach who taught them all about, like, your natural cycle. My daughter-in-law's got PCOS. She doesn't have a natural cycle. Yeah. That in itself is hell. So I'm not saying that will reduce the abortion rate, but I think if girls understood their cycles better, those that didn't want to go on contraception, and as you said, boys, men do too, I'm not sure it would reduce it, but you're more in touch, you're more in tune with your body.
Even if you just understand cervical mucus.
Yeah, and temperature, ovulation, or I'm horny as fuck today, I shouldn't be having sex.
And maybe, I use an app and my temperature from my watch.
There's loads out there
to track it, but maybe that will become more commonplace.
Well, it needs to be trendy for girls to jump on it, and contraceptive pill and the jab has been trendy for so long, and you can get caught pregnant on them. Whereas if you don't use contraception, as in like the woman, not condoms, and you're more in tune with your body, I just think you'd be more aware of, actually, this is when I'm ovulating. I want a kid or I don't want a kid.
The downside is that we know you are your most horny.
Yeah, when you're ovulating.
I know.
And that it is. So it's like, stay away, or shove a condom on or whatever.
And
So I'm not saying it reduces it. That was just my opinion. That I do think we should be more aware.
I think having a more honest conversation with young people about contraception. Yeah. And that it can make you feel really rubbish.
It's crap.
And I think there's a lot of pressure for young girls to say, no, we have to have a condom.
Yeah.
That's a really hard.
It's huge.
It's a really hard thing in that heat of the moment to say no.
No, you wrap it up, mate.
Yeah.
Go and sort yourself
certainly
out.
One of the things that I'm going to teach my son is that you don't actually have a choice. Once you've had sex, all the decision is taken out of your hands. So if you don't want a baby, you have to have a condom because you don't have any choice or say in the matter.
No, you don't. And also, why should it be okay? And I'm not a feminist, and we'll talk about that in a minute. Why should it be okay for a man to trust a woman that she is taking her contraception? Just for a little bit more gratitude, like, you're silly.
It has to be a personal decision. And I do think, going off tangent, they've tried the male contraceptive jab, and men found there were too many side effects. Interestingly, there was like
millions for a female.
Yeah, a fifth less than for women, or it was 1/5 of the side effects for women. But I would love to live in a world where women weren't raped.
Yeah.
We didn't have
Domestic violence.
domestic
both
violence.
ways.
We didn't have such poverty that women have to choose between feeding their children, the children that they have, and having another baby.
Yeah.
That would be my choice.
I find it hard having a conversation. No, I don't find it hard having a conversation because I'll talk to anyone about anything. And if our opinions differ, it's a conversation.
Yeah.
It's not an argument. I find it uncomfortable speaking to people who don't agree with it. Only because it's a choice. And you're taking it, if you don't agree with it, you're taking a choice away from something that potentially, you know, that lady could have been raped or... So what's the alternative? Having a lifetime of mental health issues because you're giving birth to a baby that was conceived by rape? I'm just like, it's a choice.
But then where do you draw the line? If you say abortion is okay in rape and incest, at what point do you say the woman's opinion on whether she should or should not have a baby comes into play? I mean, for me, I think it's become more difficult as I've found faith and many
to agree with it.
Yeah,
Okay.
Well, so many people that I love and respect are seriously pro-life.
Yeah.
And I do really, I understand it on
Both
a
sides now.
theoretical level, and I also had to walk through people shouting
murderer
to me on my way into work.
Why did you stop work? I've never asked you this.
I had a baby.
But is that why you stopped being a nurse
No,
in sexual health? Because you had a baby?
I don't think that nursing was the right thing for me to do.
Yeah.
And I had more feeling of fulfillment doing that job than I had any other kind of job.
Yeah.
But once I had my babies, I knew my job was them.
Yes.
And I don't want anything to take away from, I am meant to be their mother first and foremost. And there'll be a point in my life where I
might
can
revisit.
and I can give my full attention to something else.
Yeah, I get that.
But I believe that my role is to raise my children as well as I possibly can.
Yeah. While you can.
While I can.
Yeah, I get that. So I've had multiple miscarriages and I've had abortions. Had zero support post-abortion.
Yeah.
So found it way more harder than losing babies that I really... And it wasn't that I didn't want these babies that I had an abortion for. It was circumstances. End of conversation. I'm not going into it more than that. But my miscarriages, oh my God, they were all so very much wanted. And I struggled so much more with them.
Yeah.
And I don't know why. Like, I struggled more with the abortions than I did with the miscarriages. And I really, really wanted those babies. But I think it's because it was lonely.
Really lonely.
Because you can't talk about
and
it
there's
openly.
so much shame. There's so much shame. And why should you grieve something that you've chosen?
Exactly. Like, I'm not saying that everyone should come... Do you know what I mean? Like, I'm not saying that... Like, mine were years ago, so I'm comfortable and talking about it. And I talk about things to help others. It's not, if you've got an opinion, fuck off. I really don't care, to be honest. I know there's someone out there who'll listen to this and be like, oh, thanks for sharing. That's why I do it. But I'm not ashamed, or I wouldn't be saying it. But, oh, my God, I was for years.
Yeah.
Like, years and years.
And grief.
Oh, horrendous.
I think the really difficult thing about abortion is that it's a really, really difficult decision to make.
It
kind of fundamentally goes against what your biological needs are telling you to do. And I think that's really, really hard. It's difficult to talk to because people have really strong opinions about it.
It is, and it's family, and it was quite au fait in my family. Weirdly, my family don't watch my podcast, so I don't care what I say about them. But it was the norm. So there was no like, I didn't have to. I've got to keep it a secret from my mum and things like that. It would have been, of course, you're having an abortion, and that's the flip side, because it makes it easy.
Yeah.
Because you're not going against your parents' values or beliefs or morals.
So would it have been harder for you to have continued that pregnancy in your kind of family, societal?
Oh, I just didn't want the life that they had.
Yeah.
That's it in a nutshell. And I've now opened another can of worms, but that's fine. Who's
Yeah.
interviewing you? I'm only joking. No, it was totally the wrong time, and I wanted more for, if I ever brought little sproglings into the world, I wanted it to be with the right person.
Yeah.
And have the right support network around me.
Yeah.
And it wouldn't have been at all. So it was easy for me to do it, which sounds awful.
Yeah.
Because there's so many kids out there, and I wasn't a kid as per se, I was 18, 19.
But still a child.
Oh, I'm still am. I'm the
on,
ultimate
Sarah.
Peter Pan. Preach. But there's so many people out there who don't have that.
Yeah.
And I can't imagine.
Well, and I suppose if you look at like deprived areas, you're twice as likely to have an abortion.
Yeah.
If you live in a deprived area than if you don't. And I mean, is that just because of financial reasons, or is it because of societal pressure that if you grow up in a more middle class family, is there more pressure and then support for you to raise that baby?
Yeah.
Are your grandparents working? If your mum's a stay-at-home mum,
You're screwed.
well, but she then might be able to say, well, look, you can still have your career, you can still
And I'll
go to work, and I'll look after the baby.
That's quite common in Wales, though, especially in the valleys up there. That is what happens. Like, they've got quite a high teenage pregnancy rate up there. I worked up there on the Gurnos for ages, and teenage pregnancy isn't really seen as a shameful thing.
Yeah.
Up there, I don't know the stats, so don't bite my head off, guys, at all. But from what I saw in other places that I've worked, it was very welcomed.
Yeah.
For a 16-year-old to start her family, it was very, very welcome because the support network's there and the village is there and they've got all of that in place. I would be very interested to see geographically.
I don't have the stats, but I would guess it would shift dramatically as to where the country you are.
Yeah, that's what I mean. Like, just in Wales, depending on societal norms and where you live and it's not even how you're brought up. I genuinely don't think that. I think it's a state, and that's my opinion, it's a stage of your life where you're at when that
happens.
Unwanted pregnancy happens.
Yeah.
Because I've cared for women who've had them, and they're all very, very different. And it was just the wrong time.
Well, and we're kind of basing this on younger people. But of course, there is a lot of women that come in and they are perimenopausal.
Yeah.
And they thought that time was done. And they find at 42
that they're
pregnant. And they've just sent their kids off to university. And they're like, I can't do this again from scratch.
And that's okay. It's
which
a
is
choice.
Totally fine. But
there's so many caveats to abortion, which is why I'm like, I do believe that you either agree with it or you don't. It can't be I agree with it in this circumstance.
I think the problem is it becomes too messy.
Yeah, so I agree with it for these reasons, but I don't agree with it for that. It's a choice, and you either agree with it or not.
And
do you agree or no?
The legal ramifications become too hard. I mean, if you look at America now, where states are saying you can have an abortion up to 6 weeks, which again actually feels like quite a sensible. Well, actually, 6 weeks. There's like normally not even a heartbeat. You know, you can get your head around that. But then you go down the route of prosecuting women don't have regular cycles, so they don't know.
Yeah.
How do you treat the doctors and the healthcare staff? And then you get in a position, which I think is the real problem in America, is that doctors and nurses are so scared of losing their license that they're then not doing essentially life-saving care on women because they're scared of
their livelihood.
It's their livelihood.
So is that why you say our laws in our country, you agree with them, they're good?
Yeah, I think they're as fair as they can be.
Do you think the NHS system, services for it, well managed? I know you haven't been in it for 6 years, but do you think what we've got is the best it can be?
Probably not.
Yeah. What could be better? I know I asked this earlier on about like transportation and stuff, but I just mean that whole experience.
Well, because I worked for a charity,
Yeah.
so obviously there is a money making part of it. Like
There is in everything.
they have to
Yeah.
make the money to keep the clinics open.
Yeah.
And again, in an ideal world, that wouldn't happen. But I think it's very difficult in healthcare when you mix profit. I say that everybody I work with, I never got the feeling that they were like, you know, pushing abortion at all. Like we genuinely wanted wanted the best for women.
That one person at that time in that room.
Yeah. But I think if the NHS could do it in-house, so it wasn't privatised, that would be better.
Do you?
I do, but
Why?
Because I think it removes the notion that could be a possibility at all. The downside of that is that within the NHS, as a practitioner, looking after someone who's having an abortion is one of the few times that you can actually choose not to take part in their healthcare. So
I have a lot to say about that, but I'm not going to say it.
I agree.
You probably got a lot to say
I
about it
do.
as well.
I'm not sure that I agree that you can step away from not helping someone having an abortion, but you can treat a paedophile or any other person who I truly believe everybody deserves.
Everybody deserves healthcare.
Healthcare.
Whether it's free or not, I don't, whatever. Yeah. But yeah, everyone deserves to be looked after, cared for.
Yeah, whatever.
In a safe way.
Allegedly.
Yeah.
Not done.
Exactly.
But I think that for that reason, abortion has to be brought out of the NHS because they
never thought of it like that.
I don't think that they could fund
they
it.
Couldn't run it.
They couldn't run it.
I've never thought of it like that, to be honest, because I'm not that close-minded. I'll look after anyone. I'm quite good at putting my thoughts about someone to one side for that reason, which is wild because I am what I am. But I took that oath when I become a midwife. Yeah. It's like, it's not about you. It's about who you're looking after. So, I never thought of it that way, actually.
And interestingly, a lot of the women I worked at the clinic with were devoutly religious.
Fuck off.
Yeah. Yeah. So I worked with maybe 3 African nurses. I couldn't tell you whether they were nurses or midwives, who were really devoutly Christian. And I would say, what are you doing here?
Did you have conversations about it? And what would they say? It's my job.
They said it's their job. They also said, on a Christian spin, everyone's a sinner. Like, it's not for me to decide. And everybody deserves compassion and kindness. And I think when you're in that situation, you see how vulnerable and desperate women are.
Oh,
and I think that is, if you make abortion illegal, abortions will happen. They'll just happen dangerously, and women will die.
Yeah, women will die. People will lose their jobs. So I don't see it happening. But who fucking knows in this day and age?
10-1.
Thank you. Was there anything, because we can edit this bit? Anything?
I just wanted to. One of the things I wanted to say was that there are obviously risks to having an abortion, and I think, which is another good reason why it should not be used. Take the moral stuff out.
Yeah,
why it should not be used as contraception.
Yeah.
And I think there is a risk of physical harm and of mental harm.
Yeah.
There are 2 ways that you can have an abortion. Up to 9 weeks and 6 days, you can have a medical abortion, which has lower risks. The tablets.
Yes.
And that's mifepristone, and then followed by misoprostol. 24, 48 hours later. Mm-hmm. One of the good things about COVID is that telemedicine came in and that women actually no longer had to go to a clinic to receive the tablets.
They can have them at home.
The downside is women weren't being scanned and checked for the dates and whether they were, pros and cons with everything.
Yeah.
But I do think, certainly for women with such financially difficult situations.
Yeah.
It is a brilliant thing
Yeah.
that has happened. But the risks of a medical abortion, so it can be painful. There's side effects of the drugs: nausea, vomiting, diarrhea, headache, dizziness, fever and chills. That's 1 in 10, so a high risk of that. Retained products of conception, where the pregnancy is no longer growing, but some of the pregnancy tissue is still left behind in the womb, is 2 in every 100 women. A continuing pregnancy, where the abortion hasn't
Yes.
worked, is less than 1 in 100. If you're treated without an ultrasound to date your pregnancy, like the telemedicine, the gestation of your pregnancy may be later than realised. It's less than 1 in 1,000, but this can mean the abortion treatment fails. There is more pain or bleeding, or you may see a recognisable fetus
Yeah.
when you pass the products. And that risk, or in extreme circumstances, a live birth, which goes back to why it needs to be managed.
Decriminalised, yeah.
And, so the risk of hemorrhage, very heavy bleeding, is 2 in 1,000. You don't know how long it's going to take for the abortion to start. And you can be bleeding up to 6 weeks afterwards. The long-term risks, health effects, are you could have an undiagnosed ectopic pregnancy, it's 2 in 1,000. You could get an infection of the womb or fallopian tubes, 2 in 1,000. You could get a blood clot in the lung or leg, 3 in every 10,000, and psychological problems, which are variable.
Yeah.
So if any of those things happen, you may have to go back, either have a surgical termination or go to hospital and have a hemorrhage managed. I think one of the difficult things is when you're doing this and you go through a consent with somebody, nobody ever thinks they're going to be the 1 in 10,000.
Yeah, well, it's the same with everything, isn't it? You just don't.
Unless you buy a lottery ticket and then you're completely sure that you're going to be the 1 in 700 million chances of winning. So a surgical abortion, now this very much changes depending on how pregnant
your gestation
you are.
Yeah.
So up until about 13 weeks, you can have it done with local anaesthetic or conscious sedation or full GA. The risk of infection is the same, affects less than 1 in 100 people. Retained products of conception, less than 5 in 100 people. The heavy bleeding or hemorrhage can affect 1 to 4 in 1,000. And that's not just immediately at the time, it's up to 10 days later. And the really dangerous one, which is the perforation of the uterus, and that's 5 in 1,000.
That's
and that,
high.
Yeah.
I definitely didn't read the risks.
And that's, a very serious complication. You can have damage to your cervix, 1 in 100, and treatment failure, so a continuing pregnancy, is 1 in 100. The other thing that can happen with either of these is you could potentially get a life-threatening infection, so sepsis. And so there are real risks to doing it. So it's not a decision that should be made lightly on any front.
So the flip side of that is someone being told all those risks, and I can guarantee I probably was, but the only thing I was worried about was having it done.
Desperate.
So it goes, I'm not going to say no. You could tell me I'm going to die, but I'm not going to say no. Is that no one goes into it lightly.
Which is
when
sadly
you're being told all of that.
Why women around the world have had backstreet abortions and died, because people are desperate to have an abortion.
So just to clarify, we're both in agreement that an abortion service needs to exist.
It needs to exist.
It's not contraception.
It's not contraception. It shouldn't be used. And I think it should be dealt with compassion and kindness, but really understanding that it's massive. It's massive.
Yeah, you are right. I've never thought of it like that. I suppose it could be seen as quite flippant, and maybe some people do.
I think it's some flippant. Women that it doesn't bother them. And that's who am I to say how to feel about these things? But I mean, certainly the Lily Allen podcast, I found it quite difficult to hear.
Was it said from a place of like all her mistakes that she made? I haven't listened to it.
No, I think it was.
What was the background of it?
she said, she sang it to Frank Sinatra's I Did It My Way, and she said, abortions, I've had a few. And then she said, I can't really remember how many, 5 maybe, 4 or 5. And
She's
but
such a public figure.
she is, and I think
I get why
that I don't
it
want
moved you.
children, young people, young women to go into a situation thinking it's fine.
Yeah, so blasé.
It's fine. It's not going to have any effect. It's just a clump of cells. What is it going to matter to me?
To be honest, that people around me and you know me, I'm mama bear. You know, my decisions weren't liked.
Yeah.
They were like a few weeks in the making. They were all flippant. I didn't have one person saying like, are you sure it's what you want to do? It was more like, well, of course you're going to.
Yeah.
So, yeah, I totally get that. I've loved this conversation. I know earlier, before we started it, we were like, are we doing the right thing?
Yeah.
Are you sure that you're happy to do it? But I hope someone out there, I mean, obviously we're going to get backlog, but whatever, I don't care. It doesn't matter what I believe.
Well, and that's what I was going to say. My personal views about abortion mean absolutely nothing.
These are facts.
The important thing is that a woman can make an informed consent about whether this is something that is right for her or not, and nobody
should take that
away.
No.
And as I've got older and my views on lots of things have changed, the only thing that I know for sure is that nothing is black and white.
We live in a world full of colour. Dark colours, but, you know, well, mine's quite colourful.
Yeah.
So is yours. Yeah, no, it is. Everyone has their own reasons for doing something. Don't make it yours. That's what I think.
And if you start to limit those, you go down quite a dark path of where does that
It says more about you.
end.
It says you do you. Literally, just you do you. I'm glad that we can share the evidence and the risks. And, you know, people can make an informed choice, and they should be allowed to.
And it's only down to that
It is.
person.
It's no one else's
their
opinion
body
should
and their
matter.
decision.
5 quick questions. You haven't
Okay.
got a clue what I'm going to ask you, and you can't think about them for too long.
Okay.
I can't ask you the 3 because you've already answered them.
All right.
5. Who's your person?
I mean, currently, my person is my husband.
Love it.
Because he's gone through, see previous podcast, so much, and everything has changed for him. And yet, he just sees everything with this amazing new take on things.
Love it. Even if you don't agree.
I don't agree. But
it's refreshing.
yeah.
What a man.
He's amazing.
I'd love to be able... Oh, well, I flip my opinions on a day. Well, I've got 9 personalities, so it depends who's coming out on that morning. Am I Katrina or Marie? But it's a good thing. It's a good thing to have that open-mindedness. For you, I'm on about that you are not looking at him thinking, oh my God, I don't agree with anything you say, and where's my husband?
But the other thing is, if we can't change when we're faced with
adversity
or evidence, or if you are so stuck in what you think,
says more about you.
You're going to have a really miserable life.
Yeah.
Because everything changes.
Yeah, daily.
Yeah.
Love that. What do you hate most about yourself?
Oh, which will definitely happen after this. Waking up at 3 o'clock in the morning, thinking of the stuff that I've said. I mean, I still do it. I can do it on something I said when I was 17, and I'll have
not
like an hour. Not
related to beer, like beer fear. It's not even alcohol related.
No, I say stupid things all the time.
Have you listened to my other podcasts?
No, I think I say things out of anxiety, and then it's like a double shot of anxiety that I wake up and torture myself about the thing I said when I was feeling anxious.
You talk so much sense, by the way. So just go home from here knowing that this was great.
You really hear a very edited part of my internal monologue.
What's the one thing you love about yourself?
That I can change.
Love it.
That nothing is set in stone, and that I will go where I'm meant to go.
Yeah.
Whether that's evidence-based or faith or
whatever. You're just going to follow.
I'll follow it.
I love that you found faith, and you know I'm an atheist, and I'm quite jealous.
It's a surprise to us all, but no, it's been the
I'm spiritual.
Yeah.
But I'm not.
Well, I would have always
godly.
said that I was
Well, we're
spiritual.
very similar.
Yeah. But yeah, I find it.
Is it? So, fourth question. What's the one thing that's changed your life in the last 2 years?
Well, I mean, my husband having a brain tumour was the kind of catalyst, the explosion. But all of the good stuff that's come out of that has been wonderful.
Yeah.
Like, absolutely wonderful. And the fact that we as a family, I think when you've been so close to death, you see life in the most beautiful way. And I am so grateful. I'm grateful in every single way. And that has brought joy.
That's so much
and
joy. Like to wake up like that every day.
Every day.
And not feel like a negative notion about anything.
It's wonderful.
I
And if I could wish that for anybody.
I was going to say this.
That they would, and to practice gratitude. And I think for me, faith has made that easy because there is some being that I can thank for it. But I don't think you need that thing. I think you can just be thankful to the universe.
I bet there's loads of miserable fucking people out there who want to slap you with a wet fish right now for being so happy.
I think I'm really annoying.
You're not annoying. You're beautiful. You're not annoying. Question 5.
Yeah.
What's next for Charlotte?
I don't know. I really don't
exciting.
know. But more time with my family.
Yeah, always.
And they'll grow up really quickly and just enjoying right now and using my energy to really appreciate. It's so hard, especially as a mum with 2 young children, to not be like, just go to bed, please.
Yeah.
This is so awful.
Well, that's Jonathan who come on before you. We were talking about the word busy. I don't know if you walked in at the end.
No.
He said he doesn't like the word because you're busy doing nothing.
Yeah.
He was like productive. I was like, that's the word. That's what I was saying. Like he made me think different because I use the word busy when I'm stressed.
Yeah.
So I'm
too busy.
Yeah, I'm too busy. So too busy to spend time with your kids. Did you say on the last podcast you remember bathing them, which would normally stress you out no end, but now
sitting
you're
in
just
the
like,
hallway and watching my husband give the kids a bath.
Joy,
real, unadulterated joy, and I wish that everybody could experience that change of life without having to deal with trauma first and the thinking your husband's going to die and
isn't it
being
shit
an
that
arsehole.
it takes something like that?
Yeah, but do you know, I wouldn't. Now we're at the end of it. I wouldn't.
Well, no, because it's made you both come out of it the way that you have.
Yeah, but and if someone could have told me in it will be fine, it probably wouldn't have had the same effect. No. So you just gotta
ride the wave.
Gotta ride the wave and be grateful
and follow the path.
That's it.
I love it. Thank you, my darling.
Thanks.
I'm sure you'll come on again.